Most disability claims are gauged by what's in the medical records. The difficulty with that is that medical records aren't prepared by physicians and their treating doctors for the purposes of showing a disability. It may have a diagnosis, but it doesn't show the restrictions and limitations. A diagnosis will never make somebody disabled. You very easily have a diagnosis, it may not become disabling at the current time. For example, somebody could be diagnosed with MS. They clearly have the diagnosis. That doesn't mean they can't work. There are millions of people who have, unfortunately, have MS that are able to work. So what's important are the restrictions and limitations. So at Franklin Newfield, what we do is we'll work with the doctors and say, we understand that you're treating your patient, our client. We would like more information, such as restrictions and limitations on their ability to perform their specific occupation or any occupation if that's the definition of disability in their policy. It's very important because just handing over medical records most likely will not demonstrate restrictions and limitations on someone's inability to work. And the response from the insurance company will be, we don't question they have this condition, but it hasn't heightened to the level that is preventing them from working. So it's very important, once again, to work with the doctors to provide more specificity, more restrictions and limitations in their medical records, or if necessary, requesting them provide narrative reports or other documentation to show those restrictions.